Oh, we are back again, and I look out the window and the sun is not fully up yet, which means we are on an orthopedic surgeon's schedule. So welcome to the Restoration Group podcast, where we are sometimes silly, but always serious about investing in Oklahoma City owners and leaders who desire to integrate their Christian faith into their business. I'm your host, Clay Steves. Today I'm joined by my co-host, Michael Mead, and I'm going to use the word distinguished. Our distinguished guest, Dr. Brian Chenoweth. How are we doing today, man?
Good morning.
Good morning.
I'm so excited for this.
Me too.
This is going to be so good.
This is going to be gold. All right, formal.
Go ahead. Yeah.
No, go. What?
I'm only 3 cups of coffee in, so I need to keep it.
How many shots of espresso were in the 3 shots or the 3 cups of coffee?
Single, double digits. I don't know.
Who's counting? Doesn't matter.
Not us. Not us. Brian Chenoweth is a fellowship-trained orthopedic surgeon with OU Health Physicians, specializing in hand and upper extremity surgery. Dr. Chenoweth earned his medical degree from the University of Oklahoma College of Medicine. There's an OU theme here. He completed his boomer. That's right. He completed his residency in orthopedic surgery at the OU College of Medicine and a fellowship in hand and upper extremity surgery at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. When he is not practicing medicine, he enjoys playing guitar for all in the neighborhood to hear. He enjoys snowboarding, which he also recently got to do. Yeah, you did. And then priority one, spending time with his wife and his children. Dr. Brian Chenoweth, welcome to the show.
Thanks for having me.
Absolutely. Absolutely. You already got like it. You're just smiling.
I'm
You're just smiling.
So this is why
Intro done.
Brian is an orthopedic surgeon.
Yes.
So we talked about.
Yes.
So his
Yes.
hands are very important to his work.
Yeah.
And we didn't actually meet on this day, but the first day I saw Brian, it was back when you had some hair. You got your hair.
You did have some hair.
And you were just in your backyard with a chainsaw going to town. And I was like, man, first of all, what a man. I mean, what a man. But second, does that guy know how important his hands are? Could he get someone else? Should I do that for him? But that's just the kind of guy you are. And I still remember that as the first time I ever saw you. Yeah, it was a beautiful moment.
The old adage of orthopedics is that you stop the elevator with your head, not your hands. That's the priorities.
Yeah, it matters. And you're just out there going to town with a chainsaw. It's a sweet moment.
Good for the soul.
That's a good visual image. That is good. That's good. Okay, so let's stay in the orthopedic realm for a minute. Brian, tell us about your practice. Tell us about your practice.
So as you said, I work at OU.
Yeah.
We see everything under the sun, and that's one of my favorite things about having the opportunity to work at the Academic Referral Center is that the buck stops there. So we get referrals from northern Texas, southern Kansas, had a couple from New Mexico. It's a job where every day you're going to see something you've never heard of or seen before. And that's one of the things I love about it. I get the opportunity to teach residents, which is something that it means a lot to me. Those 28 to 32-year-olds have a lot going on in life, as I did back in the day. So I really enjoy getting to partner with them and practice together, learn together, and then get to meet a whole bunch of fun and interesting people every day.
Every day.
Every day.
You can do that today?
All day.
After recording this.
Yep, you got it.
What led, so like Genesis stories matter. I think Genesis stories often frame us and shape day-to-day actions that we don't even recognize. Like what led to you going into orthopedics?
Well, I was originally going to be a dentist. So my dad owns a dental lab, and his vision or idea was, hey, I've got all these connections to dentists. It's something you ought to think about. So I shadowed a few dentists. I thought, this is pretty cool. I'll probably do this. But then I saw what orthopedic surgeons get to do. I remember where I was sitting in my bedroom at like 17 years old, and I saw on one of those weird TV shows someone nailing a tibia, and I was just like, that.
Hold on. At 17, you somehow came across a show of somebody nailing a tibia?
It's so weird. And yet that moment was just kind of like, okay, well, I'm going to do that. And ever since then, I dabbled in other fields of surgery, but I got into medicine to do surgery, not to do medicine. The question of what would you do if it wasn't orthopedics, it'd be something with my hands for sure, just because that's the way God made me. I got to be active and doing some project all the time.
So I don't want to take us too far off the rails here, but I'm curious. We've actually never talked about this with your dad as an established dentist, kind of had that vision.
Dental tech. He owns a dental lab.
Okay.
He makes teeth.
Okay. So with the dental connections, was it hard for him to accept your career path as a surgeon, or was that an easy conversation with Dad?
Oh, very easy. They cheered me along the whole way. Yeah. So I've always been very driven and motivated, and they've really tried to set me up for success in whatever my little heart desired. Yeah. And so they were cheering me on the whole way and have continued to do so. My dad always still talks about how we need the inverse of the take your kid to work day, and someday we're going to figure out a way to take your dad to work day, but it's still in the works.
Got to get him credentialed.
Yeah, exactly.
Yeah, that's a real fun process these days. Yeah, that's knowing your dad, which I have a privilege of knowing your dad. That answer doesn't surprise me at all. That he's going to be your champion and cheering you on, and whatever your passion was and felt your calling was.
Still want to be like him when I grow up.
Keep walking in that direction. Keep walking in that direction. Okay, so let's stay like on the journey concept, right? Even as we're talking about the direction and moving one way. You have been a professing Christian prior to becoming an orthopedic surgeon. True statement?
You're here.
Okay. So talk to me then about now just the subset of your practice. So the time you've been a practicing surgeon, how has your, I'll say, application, integration of your Christian faith evolved, grown, changed over time from the beginning of your practice to, let's say, today, and who knows where it'll be in 10 years, but like, how has it evolved? Even though you've been a Christian, you've followed Christ this entire time, has it evolved over the life of your practice?
So definitely has been a interesting transition. As a resident trainee, you are typically trained to do as the Romans do, and so you adopt the fly on the wall. You learn how the mentor. It's a very mentor-mentee model. So your job is to learn, but not really shake the boat a whole lot. So as then a attending physician, everybody looks at you, and you very much set the tone. And so that's been a big adjustment in every regard. So that for sure has been a different experience working at a public teaching institution, and trying to navigate what it means to be in that role while still wanting to wear Jesus on my sleeve. And that's manifested initially as, I was raised in a Southern Baptist church, and one of the phrases that I loved hearing when I was a kid is "preach Jesus at all time, if necessary, use words." Yeah, and I think that's a really cool idea, but it can be led to some terrible application, which is to never talk about it. And so, with time, as I've become more comfortable in my role, I've learned that although I still have that role in a public institution, it doesn't mean I can't be me. And so Jesus is the undergirding of everything I do. And so for me to not include him in every part of my day is for me to not be authentic. So that's over time manifested in different ways, to praying with patients, to talking to the residents about what church they go to or are looking for, to my staff and everything in between.
So I don't know a whole lot about hospitals, but what I do know and suspect is that it's maybe not the most inviting environment for faith conversations, and each hospital's got to be different. Yeah. But I think there's probably a lot of businesses out there where we have folks listening and they're just like, I want to do what you're saying, but I'm so scared about what the consequence will be, how to do that. And so what are some of the challenges you've encountered in the integration of your faith where it's like, I want to be authentic to myself, but also I want to be respectful and aware of the environment that I'm in. How do you walk that line?
So we here in the year 2023 tend to be afraid to talk about anything.
Yes.
Just because.
Eggshells. walking on eggshells.
So that environment is every bit as part of the hospital as it is anywhere else. But the no one can argue with your experience because it is it is you. And so that's been the easiest way for me, is just to tell my story and to be, as some guys I like to talk with say, courageously authentic. And so that comes with a little bit of self-deprecation and everything in between, but leading with vulnerability and just telling, inviting others into my brokenness and seeing my walk and the journey I've been on. That's been the easiest thing for me, is instead of necessarily preaching it at other people, is just showing a little bit of me and my story and what got me here.
Man, that's so good. That's so good.
How has that, I guess maybe what's the consequence on the ground? And I mean consequence like in the positive sense, I guess, it just cause and effect. Even specifically, I'm trying to weave your experience as a resident to now you have the ability in the role, you have the position where you're investing in residents. And then now you're also becoming, you use the word more courageously authentic. You're sharing your story. Like, what's the relationship consequence for you with the residents as a leader, as someone that even by the structure, but they're looking up to you? What do you see happening there in that dynamic?
Well, any professional environment can tend toward sterility, and
especially surgery.
Yeah, exactly.
Which we want but it's
just by nature a pretty serious, high stakes environment.
Yeah.
But inviting others into your story and leading with vulnerability has a way of breaking down some of that sterility and the barriers. And if you're open to sharing your story, then someone else is going to be more willing to share their story. And then you get invited into a deeper relationship where you can have much more meaningful conversations and really take relationships to the next level.
Yeah.
And that, I think, is the most fun part of my job, not just with my trainees, but with my patients too. Is a big part of my job in arm surgery is learning about people's hobbies and their careers, because that's a lot of what makes us human is what we do with our hands. So what surgeries I offer to a farmer might be different than what I offer to a office worker, or the conversation about their expectations would be much different. But that's the fun part about developing the relationship, is to learn who you are and what you do and what makes you you. And so those relationships are both a part of my coworkers, my patients, and everybody in between.
That sounds like that process sounds like it would take time and listening and slowing down to be able to hear what might be what the patient's looking for, what the resident's looking for, whomever you're interacting with. Is that like, am I, and that doesn't normally go with, I'm not gonna say that doesn't normally go with orthopedic surgery, but like private practice space. And, my father's a retired orthopedic surgeon. We own a business that works in the orthopedic space. Like, it is high intensity, high go. That, like what I just heard you describe, is a different pacing. At least I'm perceiving it as a different pacing. I don't want to say it is. Maybe speak about that for a minute for you and balancing those two things.
Yeah, I love to think of it as like the energy that you're bringing to whatever conversation you're going to. A big focus of my leadership journey over the past couple of years has been learning to ask better questions. And what question you ask anybody is going to dramatically change what conversation you're having, how you are perceived, and the sincerity of where we are. For you as podcast hosts, if you ask me, gosh, how's the weather? That's a lot different than you asking me a soul searching deep question that's using my history as a guide. And so much the same for, all of us in any kind of leadership or not. If you're asking good questions, you're inviting people into a deeper space. Even if your time is limited and you have a lot of people to see that day, if you ask a good question, that person feels seen. They get to talk about the things that are important to them, and it just invites a much deeper conversation about what they care about.
Okay, so I just want to stay in here for a second. What are some questions that people have asked you in the last few years? And I know that's so maybe generalizations, but if you can remember any, what are some questions people have asked you that challenged you, that reframed your thought about this, applying your faith, integrating your faith, being who you are, being authentic at work? And I didn't prime you for any of this. I didn't give you any heads up, so I'm way off script right now.
Let's go.
I need you to channel your vacation Brian self. And
he doesn't exist.
I don't believe that at all. What are some questions or moments that challenge you in that way? Because you're saying you began to ask different questions to see it different. How did that shape you? Maybe in the inverse, where people were doing that for you.
I'd say it
Maybe another way I can ask my question.
Please.
What moments in the last few years have maybe done that to you? So don't try to think about.
Yeah.
So maybe because sometimes moments can be questions because they force us to ask different questions. They force us to analyze things. What moments for you in life have maybe reframed and reshaped some of the way that you've been applying you? I'll just say you and your story and how you're sharing it.
Yeah, I'd say
in the last few years.
The biggest moments where a lot of self-reflection happened came through big trauma. And that trauma has taken multiple forms throughout residency and throughout my early career, but it really framed the priorities. And so much of that sterility and shallowness that is so natural in the workplace just becomes so silly.
Come on,
and
Brad.
the people that were willing to engage me on the things that were really mattering to me at that time, those are the big moments that really shaped me, and people who genuinely cared about what was going on in my life. And it's what's made me so passionate about being at a teaching institution. And I just so love our residency, because life doesn't stop for 5 years. And we put these young physicians in such stressful, crazy environments. And we don't always know what's happening at home or what's happening in their personal life. So I love speaking to that, helping them to know they're seen, and inviting them into what life looks like down the road, and how I navigated that journey, sometimes well, sometimes not well, a lot of times not well, but speaking to it in an environment where we don't often speak about those kind of things, inviting those deeper conversations. And your questions don't have to be eloquent. They don't have to make people see how smart you are. It just is about recognizing where a person's at and being willing to be vulnerable to maybe get shot down if they don't want to go down that road. That's their decision. That's perfectly fine.
Yeah.
But if you don't engage or look for those opportunities, they won't present themselves.
Thanks, Brian. Because that's it's never it is not a simple thing to share that a part of the formative elements are trauma, right? Or trauma moments in life. And so even just your willingness to share that with us, thanks. Because that's courageously authentic. That's showing, embracing pain, and these are just principles that we believe in are fundamental to integrating your faith into your business. So thanks for sharing that with us. I also I want to active listen on one piece. I don't hear you saying that the hard should be removed. I hear you expressing like there's an element of the hard that it like residency training is hard. The dynamic of going through that is hard. There's also just going to be hard stuff in life that sometimes might induce trauma that is out of your control, but it's being present with someone in that. So like, it's not just removing the hard, but it's recognizing the hard's there. Now I'm going to come be present with you in that hard. Am I hearing that right?
Agreed. I just finished a read through of the Old Testament, and one of my just last week.
Yes,
but the one of my many take home points was, what's not in the Old Testament or the Bible? Here is Josabala, and his life was really smooth, and everything was easy, and he had a good, smooth life. No, the heroes of the Bible are those that had lots of trauma and ups and downs, and they failed, but they got back up and they kept trying. And so looking back on all of our lives, it's going to be wins and losses. And, I don't look forward to the next trial, but I know looking back that the trials I've gone through have made me who I am. So I'm grateful for them in that weird sadistic kind of way, but without them, I would not be here with you today.
Before we move on too far from the subject, I want to call something out and just make sure I'm hearing it right. Because one of the things we're hoping to do with this podcast, quite frankly, is lower the bar on what it looks like to integrate your faith into what you do. I think sometimes people can see it as this unrealistic, I've got to strive and attain for. And one of the things I heard you say in regards to really caring for people is just asking better questions. And Clay was talking about the pace of your world. And if I understood you correctly, you can uniquely care for people in a time constraint. It's not like you're slowing down to have a 30-minute conversation with them, because even as business owners, sometimes it feels like there's just not enough time in the day. And what I'm getting from you is that you can actually use 3 minutes or 5 minutes, if you use it really intentionally and mindfully, to ask better questions in this case than maybe what you would ask if you were not thinking about it. Am I getting that right? That you can weave this into your natural flow of time, and it's not like you're just spending twice as much time with patients as other orthopedic surgeons?
Yeah, agreed. I think everybody knows that the workplace is stressful, and we all have a lot of agendas, and everybody's busy and trying to accomplish their task for the day. But just to slow down and just start with even just if you're just asking, how's your kid? Is he feeling better? Or whatever, just to engage on some personal level is just to open the door to a little bit of personal touch. And people, I don't know of anybody who doesn't want to feel seen to some degree, and being willing to, it just takes the personal intent of looking at the workday through their lens and what they're trying to accomplish, and really just trying to help everybody be seen in where they're at and what they're doing.
So we've talked previously about the almost like embracing this paradox of like you need sterility in the operating room, but you don't want to be a sterile person or have sterile relationships. So there's this balance there. I want to use that same concept about control. Sure. And about control, because I'm going to tell you as a patient, when you're my surgeon, hasn't happened yet. And here's this real wood or fake wood. I don't know, but like, I'm not in the mood for surgery right now. We got more stuff to do. But I want you in control. If I'm under anesthesia and I'm completely letting go of control, I want my surgeon locked in and in control of the environment. Yet control's an illusion. Like this concept of control is completely an illusion. How do you process maybe the paradox of that? Like everyone in an OR is looking to you, and legally, like it's even just talking the US, like a part of what you all sign up for is to be the woman or the man who's in charge of this room. Yet control is such a fleeting thing to grab. How do you balance those realities?
Well, I'd say a big part of surgery in and of itself is mystical, and there's a lot of perceived lack of control in that when you go to sleep, a bunch of weird stuff happens, and then you wake up and you hope that you're going to get better. So I'd say a big part of just going into that environment, I want to try to just demystify everything that's going to happen. And for me, the hardest part of the surgery control thing is not in the OR, it's in the clinic. And that is the decision-making process and the I guess, autonomy that a patient would feel in choosing what treatment method they want. That's the control. My job is to be an educator, and I love statistics, and I love trying to make things really, really simple, and to say, I am a tool, and I have these certain capabilities, and this is what I can offer you to change the problem that you're experiencing. So the control, I would hope, would be something that you feel empowered going into that environment as a decision you have made with hopefully thoroughly thought out decision-making process. And then once we make it to the OR, it's just a procedure. It's just a simple number of steps that we do, and those are pretty on autopilot. The real meat of that process has already happened.
Okay, real talk. What about when you don't experience that you've closed that understanding gap? So in other words, you are like, I hear you, your process invites them in, you're listening, you're creating the space, you're doing all of this, but like real talk, your perception is the gap hasn't been closed to like real understanding to where how do you handle that? How do you navigate it when you believe something is the best option? And again, you're inviting them in as someone in the process. Me, I'm your patient. Let's talk about me. You are helping me see that, but I am not getting there. How do you lead through that?
So,
you're smiling as you contemplate the answer.
I love people describe leadership techniques as to try to be the thermostat and not the thermometer. Well, as someone who's never identified as a thermostat, I like to think of myself as just my own tendencies is to sense your thermostat and then try to change the temperature just a few degrees because you're a thermostat and you might set it to like 80 degrees. I can't handle that. That's not for me. But I'd say in that conversation we had earlier about being seen, I really want to know what it is, the part of your story that has brought you into my office, as a patient, as a trainee, as a friend, or whatever it is. And if I am not on your page, we've got to figure out some way to get on the same page. So that might just be engaging in some small talk of trying to figure out who you are. It may be that we just need to hit the pause button and set up to have another visit in a week or two, see if we can change the vibe of the story. You're coming into a visit with a certain energy. I'm coming into a visit with an energy. I want to try to match your energy to get onto the same page as you, but it doesn't always happen.
Yeah.
And there are certainly times where things are urgent, and I might just ask for your trust and say, hey, you lost this battle with your table saw, and we really don't have a lot of options, and we're gonna do this thing, and I'm gonna ask for your trust.
Yeah.
And we just met, and that's the way it is.
Yeah.
But a big part of that environment is speaking to people's family and to start talking about what life looks like after this, and trying to, again, see that this doesn't happen in a vacuum. And regardless of what happens here, we've got to pick up the pieces tomorrow and keep this rolling.
I'm not going to work with a table saw this weekend. just establishing for everyone listening.
It is my ambition to never need your skills. And I'm sure that's true of all people.
Cheers to that.
Nobody wants
Well,
it.
his
but when you need
chainsaw
it,
with the flowing hair at home skills, but not the operative
That's right,
formal
that's right.
training skills,
That's
right?
right.
Just
Yeah, that's right.
to clarify, we're on the same page. Okay, let's use the physical restoration. Let's even use that. And this is you've got your Habakkuk cup over here. We have talked often together about the dual restoration element, physical restoration. One of the cool parts about orthopedics is that you get to take care of patients who have lost something. Mm-hmm. And I even love the way you framed, that you are really listening to them about what is success. Why are you here? Are you a concert pianist? Because like what you need restoration wise is different than someone who doesn't use their hands all day, every day, or, maybe works out in the field. Like those are just different expectations. So orthopedics, you get to getting physical restoration every single day. Talk to me about the reflection, maybe the mirror that you get to see in that towards spiritual restoration, faith, God's restoration in your own life, like how those parallel, how those are intertwined in any way, shape, or form.
I'd say it's very different. I so love partnering with people, and whether it's surgery, not surgery, we're doing anything and everything we can in our power to get them back to whatever activity it is that they are unable to do. But what I can't help but see is the scars and so much our surgeries. We are on the cutting edge, and we're going to read all the research, and we're going to do everything that we can to bring you the best technology and the best techniques, and yet you're still going to have some stiffness. You're still going to have some scar tissue. We're still going to have to work in therapy and do everything we can to bring it back. So I can't help but see so much of what we do as a man attempting to restore, and that just stands in such stark contrast to what Jesus offers us, in that I can offer you a shoulder replacement, but I cannot offer you a brand new shoulder. And so it really just so highlights what grace is, and that we are offered new, not slightly better or the best we can do, but brand new.
I've been wrestling this recently, and I just heard a vein of it in what you talked about, that the grace of Jesus is not that all of our shortcomings or brokenness is like just covered and we get back to zero. It's that actually when we stand before God, that he sees the perfect life lived of Jesus, which is I hear you talking about, like you can try to like make the shoulder functional. I can restore it to some level of maybe back to zero, but it's not new. It's not something that is like prime, flourish, thrive. And that's I had never correlated the difference there between those things. So that's, even as you were saying that, a complete new thought to me and Lynn's. So thanks for sharing that. What did that stir in you, Michael, as he was?
A lot. A lot of good stuff. There's a phrase that I've heard and I'm familiar with that comes to mind, and it essentially says, Jesus did not come to make bad people good. He came to bring dead people back to life. Mm-hmm. And that's kind of what is stirring in my head in that, is that spiritually we're dead without Jesus, right? But also, as Christ followers, we believe in the resurrection, that our bodies will physically be restored to something we can't quite imagine, but I'm guessing that the shoulder you put in me will not be a part of that. I'll have a new shoulder, right? Yeah. If I do need that. And so there's this balance where when Jesus was here on earth, and even today through his Spirit, he still heals people. And so our bodies on this side of things still matter a lot, I think. And the gifts and calling that God has put on you is in some ways being the healing hands of Jesus to restore bodies that are broken, knowing that at some point they will be entirely new. Mm-hmm. And I think that's a beautiful thing. And that's something we're passionate about here, is not waiting for that someday in eternity in heaven to restore things, to recognize that we can be about bringing in the kingdom of God now. And you know, even back in Jesus's day, that was a pretty political thing. They thought that Jesus was coming to establish a new government and a new army and overtake Rome. When we say that, we're not talking about politics. Like, we're talking about healing and loving the poor and caring for the widow and the orphan, and our physical bodies being restored through some of the work that you do, I think is kingdom work, bringing about the goodness of God's redemptive story here and now. So those are some of the things that it stirred up.
Well, you did stir a lot on it right there. That was
Keep
good.
it going.
Maybe, Brian, talk to again, you know, our audience is Oklahoma City based, leaders who desire to integrate their Christian faith. Maybe just take a second and give them a thought of encouragement, a thought of, from your own story, from your own experience of kind of, as you know, you've talked a little bit of how you've applied it over time, how it's evolved. You've talked about praying with patience and, you know, how that's become a part of it. You've talked about the lens you've used and really staying connected with people. You've talked about that piece of it. Maybe give a specific encouragement, if you don't mind, to any of our listeners that are like, okay, I am a Christian. I hear what Brian's saying, and I'd love to start doing that in their own space and in their own business more. Give them an encouragement to maybe take a step.
Okay. I'd just start by saying you're enough.
Man,
Come on. Come on, Brian.
I have never aspired to be or never felt naturally inclined to leadership or any kind of my position is born out of just doing the best I can with what I got. And that doesn't mean I'm not still trying to learn. I love to joke that this whole leadership thing hit me by surprise. And so in no way did I feel equipped. I always saw my hero leaders as having skills that I just simply didn't have. And I'm going to lead out of reluctance, and if nobody else will step up, I will. But there's a big part of leadership that is learned, and skills and reps. And it takes some willingness to fall on your face a few times, which I continue to do, and embrace it. So it just starts with step one, and inviting Jesus into your day. And that's a big part of my prayer every morning that I do every day, is inviting Jesus into my day, or this podcast. And whatever role that might take, I just want him to be a part of it. And truly that is a big comfort in that I don't have to rely on my own skill. If I just follow the calling that he has laid before me, I trust that he will give me the words and the actions to serve his will.
That.
Mm-hmm. Well, and if I can just venture out and maybe make you uncomfortable for a second, Brian, because I'm going to praise you, and I know you're going to love it.
Yes.
One of the
Stay above the table.
Yeah.
Stay in the camera shot. Nope. Stay in the camera shot.
We lost him.
Stay in the camera shot. That was good.
That was amazing. And I want to affirm you, but I also want to share this because I think it will be encouraging to people listening. So maybe that's why I can keep you here. It's for the encouragement of others. That might relate to what you're saying is I don't feel like a leader. I don't think I have these gifts that I see in other people, whatever those might be. What I see in you that makes me feel very confident saying I think you're a great leader is that you have an incredible amount of humility. You have a high hunger to learn and grow, and you are just seeking to stay connected to the vine. I mean, the number of times you've talked about doing this with Jesus is like, if you're humble and want to grow, you're seeking to learn, and you're trying to do it alongside Jesus, and you care deeply about people, which you do, like, there's your ingredients. And so that would be that's what I see in you and what I want to encourage you with. And then for anyone listening, anybody can do that. Mm-hmm. Anybody can care about people. Anybody can develop and grow in humility. And you did speak to this. It's a learnable skill in many ways. And so if you just have the hunger to learn and be willing to mess up and fall and stumble and try again, then you can do that. And that's, I see you becoming that person, but I would say you are more of a leader today than you probably think you are. And so your journey is encouraging.
On the uncomfortable meter, how high is the rating? 0 to 10. How we doing?
I'm just hoping the lighting in here washes out the redness of my face. Probably doesn't. That's
everyone who's listening on a podcast app is like, I gotta go watch the YouTube video now. I gotta like fast forward to this.
You don't.
Yeah, you do. Yeah, you do.
Well, thank you.
Yeah.
Good words, Michael. Yep. Good words. Yeah, and that is you. That's you. So be encouraged. Thank you for encouraging me. Thanks for encouraging Michael. Thanks for encouraging whomever the viewer or listener is right in this moment. Just because you sharing your story, like you talked about, you sharing your story does that because it connects. I don't remember where I've even heard it before, right? But people admire you for your strengths, which I would correlate to the talents and the things that you were referencing that you view other people having. Mm-hmm. But people really genuinely connect with you in our weaknesses and our humanity, because that's where I think Jesus has met all of us who follow him. And that's the thing we can connect with people on. So thanks for sharing that.
Thank you.
I was going to wait on that. Cough your way through it. Get that. Thank you. Brian, any final thoughts now that we got you all flustered and red? Very red. I'm telling you, if you're not watching the video,
That's good. Thanks for that.
What are friends for?
Yeah.
Any final thoughts for our audience today?
No. Well, I guess I'd say you're here. And if you're watching this video, you clearly are interested in diving deeper. And I would invite you to dive deeper. Whatever your self-perceived lack of skill or capacity, go on that journey with somebody else and find a mentor or find a friend and explore what that looks like. Go into those weaknesses, appreciate your weaknesses, because it's nothing to be ashamed of. We all have big ups and downs.
Truth.
But sometimes those will lead you on a journey that you never expected to go down, and it may be very life-giving. So don't be ashamed of that. Don't be bashful about it. Just find other people around you and go on that journey together.
Mm-hmm. Yeah, I want to make a quick connection. You talked about back on just kind of demystifying the surgery process as something that you probably do really well and that matters to you. We are trying to demystify how to do the things we're talking about. One of the ways we've done that is created an integrated business guide. And so for anyone listening, like the best answer is what you're saying, is to do it with other people. Mm-hmm. Fortunately, some people might look around and not see anyone to do it with. And if that's you, keep listening. We're trying to create this to resource you, but also we have a free guide that is just going to demystify what some of this looks like. And there's a link in the notes where you can just download that. And that is designed to be a resource for people to go on this journey and keep learning.
Go on this journey with others and keep learning.
Mm-hmm, mm-hmm.
Yeah. Well, thank you for taking us with you today. Not going with us, taking us with you on the journey today. So the verse, I may have a little personal insight as to some of what you're praying on and what you're working on God with in your personal walk. And so it was a part of the inspiration for me in preparation. So for the verse for this episode is actually Psalm 37:7, be still before the Lord and wait patiently for him. And so, Brian, thank you for joining us today. Thank you for continuing to pour your life out for others and in service of God. And to everyone who joined us today, thank you. Thank you for watching. I'm telling you, you got to go watch. You got to go watch. Thank you for listening and watching. And until we're together again next week, choose life. Thanks for tuning into our show. If you want to learn more about how you can integrate your faith into your business, download our integrated business guide for free by clicking the link in the show notes below. Thanks again for joining us, and we'll see you next time.